Welcome back to another episode of Beyond the Desk. I'm Chad, Amy's over there, and today we're going to be talking about medical coverage in Colombia with SURA. Hello, my dear.
Hola, mi amor.
How's it going?
Muy bueno. ¿Y tú?
I'm a little nasally because my allergies are haywire right now.
Poor man.
We just got back and I had a full-on attack. And so I'm finally coming down in our nice clean house and no pollen and filtration going, but it's still there. So if I have
I
to
see it in your eyes.
if I have to do a quick little timeout to
Yeah,
sneeze,
do you.
just know.
Yeah.
Oh goodness. Okay, so a couple weeks ago we met with the amazing people over at SURA for health and medical related needs while we're
Yes.
abroad. So tell us a little bit about what happened there.
Yeah. So her name is Angela. She is with SURA. We will absolutely give you her WhatsApp number because that is how you communicate. And she gave us a call and we had a 15-minute conversation. But what I did first was I text her all of our information. She sent me through WhatsApp all of these questions. And so I sent all the answers back via text. And the next thing I know, she sent me 3 different tiers, if you will, through SORA of medical coverage. Now, I'm going to say this. It does not cover dental and vision. You have to purchase that separately. But as inexpensive as our quotes were for the both of us for 1 year, one entire year, dental and vision has got to be super inexpensive. So we're going to talk about those today. We're going to talk about the 3 different tiers. Now, I am not an insurance person, so we're not going to go over what covers what. She is your specialist for that, and call her and do the same thing that we did, but at least we wanted everybody to be aware of, what we chose, what's going to work best for us and what we're going to be paying.
So I'd love to hear just a little bit more about our conversation. Was it Angela? Is that her name?
Angela.
Angela on the phone. So what were your vibes? How did you feel about working with them?
I love her. First of all, she's bilingual, which was a huge help for us. She lives right in Medellin, and she actually did this whole conversation with us while sitting at a restaurant, relaxing and having some coffee and her lunch. So that's the lifestyle, right? So she's pretty amazing. And I saw her first. I don't know if it was, I think it was with AK Joel. And then maybe
I
they've
think
had her.
that's right. I think I remember. Bless you.
Excuse me.
I think I remember either you sent me the video or we watched it together, or you're watching it and I
Early
saw
on.
it walking by, but early on.
Early
Yeah.
on.
And then full circle,
Here
she ends up being
she
the rep
came.
that we're chatting
Yeah.
with. So
And to be able to talk with her was just awesome, to be able to get to the bottom of this and know exactly what you and I want to do, because this is not obviously why we're going to Colombia. This is where you were born. It's a beautiful country, and obviously we are going to be able to give back when we go there, but health insurance is going to be a huge bonus for us because
and it's necessary.
legit
Yeah.
cannot necessarily afford it here. I don't know who can, quite frankly.
As like a private person, when your company,
Yeah,
if you work for a company and they're offsetting part of it, it's even still very expensive.
Very expensive. Yeah.
And a lot of times you'll still have out of pocket costs on top of.
Mhm.
So it's very expensive here. So it was a breath of fresh air to go over these plans, and kind of see what we
See,
should be expecting.
can you
right?
get health insurance in Colombia without being a citizen? Yes, you can. You absolutely can. You just purchase the private uh, health insurance, which is what we're going to do. And we obviously can get the EPS as well, which is like the public health care. Um, And if you make money in Colombia, not from another country, but in Colombia, you would pay into that. But we are not doing that. We're just going to go ahead and purchase the private health care, which is phenomenal.
Right.
Phenomenal.
Okay, so let's you got the plans in
I
front of you.
do.
So
There are 3 different tiers.
let's do a quick update on our little
Oh,
doggo.
well,
Because I'm looking at your sheets and she had to inspect them.
she didn't inspect Chad. She just, got a hold of them, and so a little bit of the information, and then my little books. She also decided to, this is our
We
Sadie.
love her. That's
We
what
do
we keep
love her.
reminding
We do.
ourselves. We love her. We
But
love her.
she now has a little house that we're training. She's snoozing. Can you put a camera on that or no? Probably not.
Yeah, you know what? Let me do. Yeah, we can. I'm sure we can.
Through Amazon.
So let me switch the cameras really quick. We're gonna go to. We'll just leave it
I
here. Leave it
I
here.
it was about $100, maybe a little bit more. I don't know. So Sadie now has a little tent, if you will, that is,
Yeah, it's like a tent.
yeah, it's like a little tent. So it opens on 4 sides. So the top, um, yeah. So she is crashed out, as you can see. Sadie loves pillows, so she has her own pillow in there. She went and played with Chad's mom's dog Doodle today, and she's just now getting back into the swing of things of playing around. Anyway, this thing is amazing. It is a crate, but it's not a wire crate. Obviously, it's mesh. It's pretty durable. But we have to train Sadie to stay inside of that because, as you can see, she still tends to destroy things. So, in order for Chad and I to be able to go, babe, I'm a little crooked still. I'm a little crooked.
Just lean into it.
Just lean. I don't know which way to lean. Like the Tower of Pisa here.
There you go.
There we go. Thank you. So anyway, we have to work with her and train her because she still has a lot of separation anxiety. And by the time we get to Colombia in December, we've got our date now. It is December the 6th. We're going to be leaving, and we're going to talk more about that on the next episode. But we get a dog sitter. So that's a thought, like a babysitter, so you can have a date night. We're either going to have to do that, or she will get trained to be able to stay inside of this crate because we don't want her tearing up
A rented
anybody's
place.
a
Yeah.
rented place, yeah, our Airbnb. So,
Yeah.
nor do we want her doing it here anymore either.
And maybe a combination of both. Maybe she is
Maybe a
trained
little
on
bit of both.
that, but
Yeah.
also, and again, we're going to get into this in the next episode and the upcoming episodes, but having an assistant and maybe they're also
Yeah,
a dog
we do want
friendly
an
one,
yeah.
so they can kind of double
Yeah.
duty.
But
So
this thing folds up and folds into like a bag,
like a
almost
tent.
like a tent. Except it's not all that big. You can put it over your shoulder and carry it. So this was going to be easier for us to get through the airport with. And anytime we go to the park or anything like that, this goes with her. Like this is her safe space. And as you could see her snoozing away, she loves it. So we're doing a lot of high value treats in there. She loves frozen blueberries, her beef lung, her dehydrated beef lung. So lots of high value treats. And so when I started giving her those high value treats, she was like, oh, okay. Every time I'm in here, I get a really high value treat. So she's crashing. Like she loves it.
Yeah.
That's
Okay,
the
so
update with
let's go
Sadie.
over plans.
Yep. So there are 3. The global, like you said, we also have it translate to the word evolve, but it is I can't see it. So sorry. Classic. And then the other one is the Classico, which the classic is what we chose, and that's that mid tier. The global is the highest one, and here she said it's like a PPO in America, but better. And boy, was she right about that. So the Classico, our annual payment for that would be USD would be about $3,000, and that's about 14,500,000 Colombian
Yeah,
pesos.
14.5. Yep.
And then the
And we're doing a rough estimate of
Evo,
4,700. Like it fluctuates, right?
yeah. And then the Evo Luciana is the bottom tier. Still great coverage, y'all. It's like really great, is about 12.2 mil Colombian pesos, and that would equal about 2,600 USD. And then the global annual payment, so that's your top tier, incredible coverage. And we're talking like house calls. We could
For all three.
for all three. Like the doctor will come to your house for all three,
Yeah.
and it's covered. Just crazy. But 18.3 mil Colombian pesos, which comes out to be almost $4,000 annually for two people. And we're not spring chickens. So here in America,
Speak for
speak
yourself,
for
miss.
yourself. So, as we get older here in America, insurance gets even more expensive. And then they've kind of put you out to pasture by the time you get Medicaid, and I'm looking at the
Yeah.
elderly here in America. We're not doing enough to take care of them. They're still having to pay so much out of pocket because Medicaid is now not covering what it did previously. Will Social Security even be around by the time we get there? Maybe. I don't
And people
know.
are still having to work
And people are still having to work.
way later than they should.
Yeah.
And then you get to an age where you just can't do stuff anymore when you can finally stop working because you qualify. And now what kind of life is that?
It
It's
just
a
doesn't
broken
make
system.
sense.
It's a broken
Very.
system. And, we're not going to dive too deep into what the whys behind that. But for us, we wanted an alternative. We
For
wanted
our
to figure
personal
out.
journey, yeah. And we wanted to be able to give ourselves the best option. And in Colombia, it seems that they really do try for a holistic uh, care first before they just dive right into giving you a prescription medication. So they do have really good health care, is my point. They have really good healthcare system there. A lot of other things are pretty wacky there, like the political system, but ours is much better, really. So
Yeah, I mean it's different. So
it is
most
different.
of what we've gone over, if you've been following us since we started this journey, rarely is anything just a straight apples to apples comparison.
And you really can't.
Well, we can say it's what we know, what we're familiar with, and what does that kind of convert to.
And what works for us?
Right.
So it may not work for everybody,
So
right?
yeah, so let's jump into just a couple of the specifics of the plans.
Yeah.
Just like kind of inclusions of why are they these differences, not just in prices, but like some of the inclusions. We're not going to go into everything because realistically, one of the things everybody should be doing is they should be investigating for
Yes.
themselves of what their particular needs are, what
And
their budget is, and what solutions they need for their life, which is going to be different than you and I.
which is why they need to contact Angela, because she's the guru with this and she's going to be able to give you all the answers that you need. Not us.
Yeah. So you've got your page there.
It is in Spanish, just so everybody knows. It is not in English. And
This is
so
not Amy struggling with
it's not, it
it's a
may be a
different way.
little bit of a struggle.
So one of the things I did is I took these digital versions and I stuck them into ChatGPT and I said, what's the difference between these? Break these down for me. Mainly because we would have to translate them to English anyways. And then once we
Yeah.
did that, understand what the differences are. And so there's some base core differences that we'll go over. I think I've got us both on camera right now. So let's start off with Classico,
Which
right?
is what we chose.
So this we talked about the premiums. And I gotta go one thing. Yes. So we looked at the premiums. They gave us a breakdown of the premiums of my portion, Amy's portion, and what we talked about quote wise earlier was both of us.
Mm-hmm.
So we're talking what 200-300 total for both of us. 320 was the highest, right?
320 was the highest, but ours is going to be like $260
for both.
For both.
That's impossible in the United States.
You can't do that here.
You can't
right,
do that here.
Right.
Okay, so with that coverage wise, hospitalization,
medical and surgical,
unlimited.
100%, 100%
covered. So if you need to go in for a medical purpose or you need to have a surgery, 100% covered. Prosthetics, up to 171.6 million covered annually. So prosthetics, I'm curious if that's a word that translates a little bit different.
Something else we'll have to ask her because we noticed that on all of them.
What we call prosthetics are like limbs that were lost that have a
Correct.
replacement, but this could be,
Who knows?
it could be hearing aids.
It
Could
could be.
all teeth. I don't know because that's not all. It could be, and it could be some
I don't
things that we
know.
just don't know.
Yeah. So we're going to just make sure that you
It's a hard
look
bullet
into
point in the
Yeah,
paperwork.
it is a hard bullet point.
Yeah.
Travel assistance. This was new for us.
Yeah.
So what did you see about that, Chad?
Travel assistance, we have coverage up to $50,000 US, and that is a maximum per trip.
Per trip.
Right. So we have coverage for travel.
Here in the States.
Yeah. So essentially what that means is, because we're paying annually, even though we may not be there the entire year, we pay for the entire year. Okay. That means that there's the possibility of, if we were to live there 8 months of the year and we were on this plan, right? It would give us the opportunity to then come back to the United States, and we would have our health coverage covered while we're traveling abroad, or Europe or another country.
Or they give $50,000 towards it. Not that it would be covered. I think they would cover it. I think it's like
I may be wrong then.
$50,000.
I thought it was, I don't know.
Go back to your page. It's 50,000 USD maximum per trip. So they would pay for, or reimburse us rather, if we had to go to urgent care, we had to go to hospital or something like that.
I'm sorry. What I was trying to say was our coverage extends outside of Colombia.
Yes, it does for travel.
That's what I was getting to. And if we're traveling, coverage is up to $50,000.
Correct.
Yes. Okay. We're on the same page. I approached it differently. So thank you for clarifying.
Coverage in Colombia.
Yeah, we just went over the coverage in Colombia.
Was pretty much 100. I mean, I don't know. I think pretty much everything is covered.
There's going to be situations that we're going to have to look at that are policy specific, but it seemed like broad coverage, pretty much everything looked like it was well covered.
But if you look at the global.
Okay, so we don't want to look at the bottom tier one?
We can do either one, whichever one you want to go for.
All right, let's do the next one.
So it seems like unlimited for hospitalization for all three.
Yep.
That's beautiful. We don't have that here. Medical and surgical is according to general conditions. So that would be a question that you would want to ask Angela.
Right.
That makes no sense to me. I wouldn't even know where to begin with that.
Angela also seemed like she wouldn't put somebody on a coverage unnecessarily.
Correct.
Right. So there would be the qualifying questions, and then here's what we actually recommend for you.
Which is what she did with us.
Yeah.
She made it super easy, everybody. It was painless, truly. And it gave us, like, we knew immediately after the phone call which one we would choose, what was best for us. So anyway, so travel assistance, for the lower tier is not, they do not provide that for you. And then for the global, you do get the same as the Classico for travel assistance, so same as us. The prosthetics seems to be more. They offer more for any prosthetics, and again, we don't know what that would include. Medical and surgical fees, SURA rates plus 20%.
So you're getting wholesale plus 20.
Plus 20,
right?
Which is incredible.
Yep.
And then again, hospitalization is unlimited. So that global, you're definitely going to get more, which, maybe 10 years, we might move up to that one. I don't know.
Yeah. It depends on if it's going to fill a need that we need, because, more expensive does not always equal better. It needs to be tailored to what your actual needs are. Mm-hmm. So yeah, and as we continue to explore it and jump into it, we may find that there's some things that are lacking that we'd like to have that might be on global, or totally unnecessary, and we don't need to spend an extra whatever annually. So
yeah, but they do all the testing there, MRIs, they do colonoscopies, they do mammograms, they do it all for what men need, what women need. And I know that Medellin has 2 or 3 of the best hospitals in Latin America. I don't know if you knew that or not.
That's amazing.
It really is amazing.
Awesome. Okay, cool. Yeah. So
So that was
You
our.
mentioned what we're choosing. That was the last bullet point that I had in my head is what are we doing? We know what we're doing.
We know what we're
We're
doing.
going middle ground to start
Mhm.
off. And
Super affordable, my God. And we can take trips now. So if we needed to take, like, we're going to go down for 3 months. So December into January, February, March, and then come back. If Chad and I needed something done, we could legit hop on a flight, go down there, get it done, and then come back.
right,
Like, we don't have to wait another 9 months before we make a trip down there, which is really amazing.
right. So we have our initial waiting period, and then
Yeah.
we are covered.
Yep.
Yep.
So there is a wait period. I'm not sure what that is. She didn't specify that either. Sadie's tongue is out and she's dreaming.
She's twitching.
She's exhausted. Um, but there is a wait period. So I think we're going to go ahead and purchase this probably in like September.
Yep.
So we'll go from September all the way to September. So we'll be good to go by the time we get there. And you
We'll have to
are
add that.
going to have some procedures done, yeah? You are going to go down there and have some stuff
Yeah.
done.
Yep. Absolutely. Yeah.
Yeah.
Not anything major. But
No,
yes.
just your annual
Clean up.
checkups.
Yeah. Cool. Okay. We good on this?
We're good.
All right. So what do we want to do for next week? You mentioned you kind of
Yeah.
hinted at it.
So next week, if you guys can see, there is the board behind me here. So Chad and I have laid out May. So we started in May because we're in May. So every single month, we're breaking down in small chunks of things for us to do. So that we're really, really prepared by the time that first week of December comes. And all we really have to do is pack and get Sadie's papers taken care of. And then obviously 3 days before our flight, we do our check meg. So, which has to be done before you go into Colombia. Can't be done before that 3 days. So we're going to be talking about that next time.
Yeah. Talk about our plan, the things we've got going on.
Our travel plans, like how we're going to get down there, what airport we're going to fly out of. And we've done so much research around this. So it's really what is going to work for us. Yeah, that's it.
All right.
So until next time, what is that? He's doing this to me. So until next time, guys, keep expanding your horizons and living beyond the desk. Have an extraordinary week.